So this is something that Tim shares. And Tim, thank you for sharing this. I saw this video, and it's been circulating around the blogosphere, but Common Dreams did an article about it. So if you're poor, you're dead. Watch these Brits gasp. That was a tough one. Watch these Brits gasp when they find out the cost of healthcare in the United States. So basically, this video was made where they interviewed people on the streets in England, and they were like, guess how much this costs in the United States? And they would say something like an ambulance ride or diabetes medication or whatever it may be. Britons, in a video released Tuesday, expressed incredulity and shock at the high cost of healthcare in the United States and thanked the United Kingdom's publicly funding and administered National Health Service. So if you're poor, you're dead, one young woman tells the interviewer from Joe Politics after hearing an asthma inhaler in the for-profit U.S. system cost between $250 and $300. Two different men appeared shocked when they told Americans can be charged $2,500 for an ambulance ride. For real? One asked. Why? Asked another. Well, I'll tell you why. And now they're saying our NHS is not for sale. So what spawned a lot of this was that the Tories and the Conservatives in England now are talking about making the NHS more like our system in the US. So now people all over England are saying, whoa, no, our NHS is not for sale. Because they're finding out, well, what really goes on in the American system. And isn't it interesting how shocked they are to hear what medicine costs in the United States, to hear what an ambulance ride costs in the United States? And the answer to their question, why, it is because we have a for-profit system where we have allowed these third-party predators called insurance companies to dictate our lives, to dictate our health. It is beyond morally disgusting. It is light years beyond morally disgusting. And it is inefficient. It is a waste of money and resources. It shackles medical professionals, most of whom would rather just practice medicine, which is what they signed up for. Ask a U.S. doctor. Most of them will tell you, man, I didn't sign up. I signed up to be a doctor, to practice medicine. I didn't sign up to do eons and eons of paperwork. So that's why it costs this much in the United States. And it's, if you live in the United States and you're not sure how broken our system is, if you watch this show regularly, I don't know how you can't be, sure about that at this point. But in case you're not, ask somebody from a different country. Talk to them about our healthcare system. And watch their eyes just kind of light up in shock and horror as you describe how it works. I mean, and I've had these conversations. I've had conversations with people from Canada. I've had conversations with people from England. And a lot of times these are, there was one time I was talking with a buddy of mine. He's a comedian buddy, very intelligent dude, was not familiar with the U.S. healthcare system. He was from Canada. And it was just blowing his mind just how it worked. He was like, so wait, it's like you have to buy it like car insurance. And I was like, yeah, basically. And this was before the Affordable Care Act passed, by the way, but it's still the same principles. And he was like, so wait a second, they can just, and all these things were just blowing his mind. He's like, and then you have to pay for this, and I was just like, yeah. And then I remember the question he asked me, which was kind of funny in a very dark way, but he was just like, and he was serious. He wasn't trying to be funny when he asked this question. He was just like, so wait a second. Like a lot of times with car insurance, if you're at fault, the way you're compensated works differently. Like there's different types of car insurance where if you're at fault, you might be liable to pay more in a lot of cases. That's typically a common thing in car insurance, depending on your policy. So he asked me this question where he was just like, are there U.S. healthcare policies out there where if you try to kill yourself, you're not entitled to anything? Like they're just going to be like, hey, you're on your own. And again, he wasn't trying to be funny. Like he was asking, like he legitimately was curious. And his friend was like, dude, shut up. And I was like, no, that's a valid question. And to be honest, I'm not even sure. I mean, there's so many predatory policies in the U.S. Could there be something out there like that? And they get away with so much because they find these loopholes. There very well could be something like that. where, hey, if you try to kill yourself and you're not successful and you need medical care because of it, the insurance company, well, if you tried to kill yourself, that's your fault. So tough luck. You know, I mean, do I know for sure there's a policy out there in existence? I can't speak to the total, but my point is that shows you how ridiculous our system is, how insane our system is. That when a British person hears about it, they're like, so basically, if you're poor, you're dead. Yes. And they like it that way. The ruling class set up that system, and they like it that way because they need to find some way to get rid of poor people. We sure as hell don't want to give them jobs. We sure as hell don't want to give them living wages. So they can either die through things that could have been prevented because of our broken healthcare system, which thousands and thousands and thousands of people every year in the richest country in the world die because they don't have healthcare. They die from things that could have been treated and cured and prevented in the first place, but they die because they didn't have healthcare. That happens constantly in the United States, the richest country in the world. You know how often that happens in England? Never. You know how often that happens in Canada? Never. You know how often medical bankruptcies happens in those countries? Never. It never, ever happens. And every single other industrialized country has a universal system. And even the system that allows private insurance, allows a lot of private insurance. You know, in a lot of these systems, there is a small role for private insurance, usually for electable things like cosmetic things and stuff like that. Switzerland has a bigger market for private insurance, but it is incredibly regulated and incredibly protected so that consumers don't lose out. And by the way, their system is almost as expensive as ours. So it's the only other system in the industrialized world that is almost comparable to ours in terms of price. It's still a lot cheaper, by the way, because they actually protect their citizens, but it's comparable to ours in terms of price. And they actually do get worse results than other just straight up nationalized systems, universal, nonprofit, single payer model systems, which is what pretty much every other industrialized nation in the world has, except for the United States. And the only proposal out there that gives us that, Medicare for all. Bernie Sanders, Medicare for all plan. So if you're poor, you're dead. That's a shitty healthcare plan. But you know what? That's what we should call our healthcare system in the United States. That's really what we should call it. If we're being honest about what it is, that's what it should be called. So if you're poor, you're dead. Sounds great. Sounds like number one, doesn't it? USA. Thank you for sharing that, Tim.
Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. You can tweet me an article at Ron Placone. We'll go through it together and make it our own. Get your news on with Ron.